Welcome to the segment on preparing for cardiac catheterization. Here you'll learn what cardiac catheterization is, how to prepare for it, and what happens before, during, and right after the procedure. You'll also hear from patients who've had cardiac cath lab procedures. In cardiac catheterization, a thin, flexible tube called a catheter is inserted into a blood vessel and threaded through it into your heart. Cardiac catheterization can be used to examine your arteries and heart valves, or to measure how well your heart is pumping. Your doctor can also use devices at the tip of the catheter to treat artery or valve problems. Other segments explain specific treatment procedures. Here, we'll focus on what happens before, during, and after any cardiac catheterization. Before, you'll meet with your doctor to talk about the procedure and any special instructions you need to follow. For example, you may have to stop taking some medications ahead of time, especially if you have diabetes or take blood-thinning medications. And you'll probably be asked not to eat or drink for several hours before the procedure, sometimes starting at midnight the night before. Tell your doctor if you are allergic to any medications or to iodine or dyes. It's important for your doctor to know exactly what you're taking, so bring a list of all your medications and dosages and any other herbs or supplements you take. Also, tell your doctor if you're pregnant. If you have a cold, flu, or fever the day of the procedure, tell your doctor or the staff. When you arrive at the hospital or clinic, you'll fill out paperwork and change into a gown. A nurse will clip the hair from the patch of skin where the catheter will be inserted. This is often in your groin, but maybe in your arm or wrist. You'll get an IV line in your hand or arm, and we might draw some blood for lab tests. For some procedures, you'll have medication that helps you relax and feel sleepy. If needed, we'll help you stay awake so you can follow your doctor's directions to cough or breathe deeply. For other procedures, you'll have general anesthesia so you can sleep through it. Cardiac catheterization usually takes about an hour. You'll be moved into the cath lab, a room with an exam table and equipment. The room may be cool, but you'll be covered, and you can ask for a blanket. Your doctor will inject numbing medication where the catheter will be inserted. You'll feel a pinprick and some burning for a few seconds. After that, you might feel pressure, but you should feel no pain. The doctor will insert a short plastic sleeve called a sheath into a blood vessel. Then the catheter will be put into the sheath and threaded toward your heart. Depending on why you're having the procedure, the doctor might inject contrast dye through the catheter. If this happens, you'll feel some warmth for a few seconds. Images of your heart and arteries will appear on a monitor and guide your doctor, and the doctor might explain what he or she sees. If you're in the cath lab for a treatment procedure, it will happen at this point. When the procedure is complete, your doctor will pull out the catheter and remove the sheath. Your doctor might close the site with a stitch or closure device. After the procedure, you'll be moved to recovery, where you'll lie down for several hours to prevent bleeding from the catheter site. We also may need to put pressure on the site to prevent bleeding. Relax and enjoy the time off. We'll monitor you and help you with whatever you need. While you're in recovery, drink plenty of water. Water helps your body get rid of any contrast dye used during the procedure.
Don't be frightened of it. Don't be scared of it. Really, if your procedure goes like mine, you're not going to feel a thing when they're actually doing the only thing you'll feel is the coldness of the operating room. But operating rooms are always cold. So that's just, and it's for your benefit and sake that they are. But other than that, there is nothing to fear. There's nothing to be afraid of. And besides, you're doing this I hope you're doing this not because a doctor told you to, but because you want to know whether you have got a buildup of plaque or whether there are any obstructions in any of the arteries. That's important. You ought to know. So you're doing it for you. And like yourself, respect yourself, admire yourself for doing it.
To learn more about how to care for yourself once you go home, view the segment called Going Home After Cardiac Cath Procedure. To learn more about a treatment procedure, watch the video on that procedure and talk with your doctor. And remember, be sure to ask questions.